Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
all of the following are antihypertensive drugs which increase the plasma renin activity, except clonidine does not increase the plasma renin activity. Hydralazine and nifedipine captopril will increase plasma renin activity. Plasma renin activity is increased by increase in whenever there is reflex increase in sympathetic discharge. Reflex increase in sympathetic discharge will increase the plasma renin activity. Clonidine will actually decrease the central sympathetic activity. It is a sympatholytic drug. So as a result, it does not increase the plasma renin activity. It will decrease the plasma renin activity. Which antihypertensive drug is a prodrug and is converted to active form in the brain. So in these given options, methyl dopa is a prodrug and it is converted to alpha methyl norepinephrine in the brain, whereas minoxidil is also a prodrug. It is converted to minoxidil sulfate. It is converted to minoxidil sulfate, but this conversion of minoxidil sulfate mainly takes place. It is converted to minoxidil sulfate in the periphery, not in the center, not in the brain. Next.
thank you and thank you for watching.